Hello and welcome to Courageous Doctors, the news show for you and your doctor. On this show, we're going to cover Obamacare updates, other healthcare news, and health and safety tips. Now let's begin. According to the Star-Ledger, the Supreme Court upholds Obamacare with a 6-3 vote to allow federal subsidies for buying insurance in states where the federal government runs exchanges. This affected 2,000 people in New Jersey who rely on these subsidies to pay for their insurance premiums. According to the Wall Street Journal, the OIG, which is the Government Oversight and Investigative Branch of the government, reports that the CMS, which is the Center for Medicare Services, is making payments to insurance companies on the exchanges without verification due to incomplete computer analysis. The Washington Post says that 40% of the silver exchange plans offer a limited choice of docs, according to a Robert Wood Johnson Foundation study. In the Congressional Quarterly, we see that states will now be reimbursed 23% more for children's health insurance, that's Medicaid and kids care, and the states will only have to pay 12% of the cost to run these programs. That's a welcome relief for us. The Associated Press says that the House has voted to eliminate the Independent Payment Advisory Board, which was set up to curb Medicare spending. Stay tuned on this. We'll see if it goes through. According to the Star-Ledger, the State Senate Committee passed a paid sick leave bill, which, if going through the entire House and the Assembly, would replace the now bills in 9 New Jersey cities that have their own paid sick leave. Those cities include Montclair, Newark, Jersey City, and Trenton. Reuters says that Congress is working with the White House on the 21st Century Care Act to increase funding to both NIH, the National Institute of Health, and FDA, the Federal Drug Administration. These funds will come from selling oil from the National Petroleum Reserves. Star-Ledger says that Barnabas Health is now merging with Robert Wood Johnson Health to include 11 acute care hospitals, 4 children's hospitals, a behavioral health center, ambulatory care centers, fitness and wellness facilities. Now, out of the 72 hospitals that New Jersey has, only 5 remain as standalones. Now let's move on to other healthcare news. Star-Ledger says that a new tick disease is found in New Jersey. It's called Miyamoto. It looks like Lyme and it's treated basically the same. Star-Ledger also says that MERS, M-E-R-S, Middle Eastern Respiratory Syndrome, is now in South Korea and 24 other countries, including the United States, Britain, France, and Germany. Time reports that the parasite Cryptosporidium has caused intestinal illness across the country. It is found in pools, hot tubs, and lakes. Los Angeles Times says that a blood test is now available to detect early pancreatic cancer, and it's being developed at the University of Texas Anderson Cancer Center. So stay tuned and we'll see when it's ready to come out. Boston Globe says that the Health and Human Service is now funding 9 hospitals nationwide to develop regional Ebola treatment centers. Remember, last year, the hospitals were trying to get expertise, and now we're going to fund 9 hospitals and make sure they're ready. Medscape says that the AMA found that 60% of docs are still practicing in small practices, and that includes me. The Star-Ledger says that New Jersey's cost for nursing homes is higher than the national average. The annual rate of a semi-private room is here $116,000 compared to $80,000 nationwide, and for assisted living, $68,000 compared to $43,000.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Hi, my name is Marla Gruber, holistic health coach, smile expert, founder of the WIN program for children, a yogi trainee, and a mom to 2 teenage children. I'm excited to introduce into Dr. Barry's office my services of increasing your child's positive energy. My goal is to get the body comfortable so it can function at its full potential, enabling them to smile from the inside out daily. I will help both you and your child understand that being healthy is not just an absence of disease, it's having vitality. I believe that life is a journey, not a destination. I will help you enjoy the process of guiding your child to living a better quality of life and being the best that they can be. I look forward to helping you. Thank you for listening and keep smiling.
Now let's move on to health and safety tips. The New York Times says that the FDA is giving the food industry 3 years to remove trans fats. However, Star Ledger warns that just because it says 0 trans fats on the label, you still have to make sure if there's partially hydrogenated fats and oils, that means the trans fats are still there, so read your labels. Associated Press says that E. coli contaminated bottled water and was taken off the shelves from 14 different brands. So no illness was reported, thank goodness. So for those of you that buy bottled water, just double check it, the brands. The Wall Street Journal says that most cases of mushroom poisoning are actually from edible mushrooms that were improperly stored or consumed too soon after harvesting. So be careful if you're a mushroom lover like me. Star Ledger says that there was a recall on cashew nuts from some of the Maya brands, Maya Company, because of salmonella contamination. There was no reported illness, but you may want to check that out. According to Time, the federal data shows that 90% of Americans are still eating too much sodium, over 3.5 grams a day. Remember, you want to get that under 2 grams. And this was done, these numbers come from 2011 to 12, but I have a feeling that it's not going to change much, and we really have to be careful. According to The Hill, the Senate Appropriations Committee is allowing school lunch programs a delay in complying with the Department of Agricultural rules, remember that we reported on in the past, where you have to serve only whole grains and reduce sodium. And the Senate committee said if the schools are at least meeting half of these requirements, they'll be allowed to do so for the next 3 years. According to the Washington Post, Consumer Reports recommend not using liquid laundry detergent pods due to poisoning by children ingesting them. However, powder pods are still okay. Star Ledger says that New Jersey is the eighth leading in asbestos-related deaths, according to Environmental Working Group Action Fund. The scary part is deaths may not actually show up for decades. Star Ledger says that the American Orthopedic Society for Sports Medicine has reported at a recent conference that 1/2 of the Tommy John surgeries on elbows are in 15 to 19-year-olds. This is not good. I mean, we normally think of this as something on a professional baseball player, a pitcher, and so we really need to see what's going on here. Also, most teen surgeries are done on the knees, and teens that have undergone these surgeries in high school are at increased risk for suffering re-injury in college sports. On a lighter note, the Star Ledger reported on the United States Swim School Association rules for safety at the beach. And I think these are fairly common sense, but swim near a lifeguard, don't let children into the water alone, don't dive headfirst into the water unless you know how deep it is, and teach children how to swim out of rip currents. That's a scary thought. And an even lighter note, Star Ledger goes on, tips for picky eaters. I like these. Have the child pick out new fruits and vegetables when they're at the store with you. Always good. Get them interested. Have the child plant vegetables in the garden. They can eat what they planted. Have the child help in preparing meals. I like that. Introduce a new food many times. Don't give up. Keep trying. Have one meal time for everyone. You're not a short order cook, as the paper says. One meal, it's your house. And only keep healthy foods at home. And that's the conclusion of our news program. I thank you again for watching. As always, we welcome your comments and look forward to seeing you again next month.